Hello friends, today we will be discussing about anti-anginal agents or the agents used in the treatment of angina pectoris. Angina pectoris is a symptom or a disorder of a cardiovascular disease. Okay, it is a symptom of a cardiovascular disease. This cardiovascular disease can be defined as a disease that involves heart and blood vessels. Okay, so cardiovascular diseases may include like coronary artery disease or ischemic heart disease, stroke. It is also called as cerebrovascular disease, or hypertension, rheumatic heart disease, cardiac arrhythmia, cardiomyopathy, etc. So the drugs used to treat these cardiovascular diseases are called as cardiovascular agents. So under that, these cardiovascular agents is broadly classified. It can be broadly classified into mainly 7 types. They are anti-anginals, antiarrhythmics, antihypertensives, anticoagulants, anti-hyperlipidemic agents, hypoglycemic agents, anti-thyroid drugs, and thyroid hormones. Okay, so now today in detail we will discuss about the anti-anginal agents, or also called as anti-anginals. Okay, now before going to anti-anginal drugs, we need to know we should know what is angina pectoris. Okay, the word angina pectoris is a Greek word. Okay, it is derived from the Greek word, means angina means meaning choking or feel of pain or a discomfort, and pectus is normally called as heart. So severe pain or choking type of pain is called as pain in the heart is called as angina pectoris. It is a disorder of the cardiovascular disease that is called as ischemic heart disease. Okay, it is a symptom or a disorder of the ischemic heart disease. So now, what is this ischemic heart disease? This ischemic heart disease is usually resulting from the advanced stage of atherosclerosis. So what is atherosclerosis? We will see later on. So the reason for the ischemic heart disease is mainly advanced stage of atherosclerosis. Okay, now we'll see what is ischemic heart disease. Okay, ischemia. The word ischemia means reduced blood supply or inadequate blood supply to any organ or part of the organ. So that is called as ischemia. So that condition happening in heart is called as ischemic heart disease. Okay, so now this angina pectoris, as we all know, it is a pain, severe pain or a choking like pain in the heart, which is due to ischemic heart disease. So what happens here? Is when there is an attack of angina with angina pectoris, which can be characterized as a sudden severe pain. There will be a sudden severe pain in the chest, and that will radiate to the shoulder and then to the left arm, the left shoulder and to the left arm. Okay, so the any episodes of angina pectoris is nothing but the sudden severe pain in the chest, which is originating in the chest, and then it will radiate to the left shoulder and then to the left arm as it is. Okay, so this is a typical symptom of angina pectoris. So in some patients there can be some atypical symptoms also, like what you call indigestion, nausea, vomiting, diaphoresis, etc. Okay, so now why it is happening? What is the theory behind this angina pectoris? Is what is happening behind? That is, in angina, why it is happening is because sometimes in the heart, okay, there will be a difference in the blood supply. Okay, there will be a difference in the difference between the blood supply to the heart and the demand for the oxygen from the blood supply. That is, the blood supply to the heart is not equal to the demand of the heart for its normal metabolic functions. Heart is expecting more oxygen from the blood, but the arteries are not able to supply the adequate amount of the blood to the heart. So the heart for the heart to function normally. Okay, so why this is happening? Why this is happening? This condition is happening. This is mainly due to decrease in the coronary blood flow, or it may be in addition to increase in the myocardial oxygen demand. Either the oxygen demand for the heart is increased, means the heart is doing overload, heart is working more, or the normal supply of the blood to the heart only is reduced. Either of this or both of this can be the reason for this difference in the blood supply and the demand. So this is the reason for the angina pectoris. But in this condition, there is one more very important thing which we have to note down. Okay, so that is, it is important that this insufficient blood flow. Okay, we said that it is insufficient, blood is flowing very less. Okay, and also oxygen supply is also less. Okay, fine. Apart from that, when the blood is flowing to the heart is reduced, so then the amount of the nutrients or the metabolic byproducts which is carried by the blood to the heart is also diminished. Okay, so at that time what happened, the cells are deprived of the nutrient, the cells are deprived of the nutrients, the cellular nutrients are reduced. Okay, so this is also a very important point which has to be noted in angina pectoris. And then why it is happening, what is the reason for all these things to happen? The underlying cause is the atherosclerosis. As we are, most of us know what is atherosclerosis. It is nothing but the constriction of the coronary arteries. Why? Why means there's a erythema, formation of erythema or a plaque formation in the blood vessels of the coronary arteries. That is nothing but the cell constituent, and on the epithelial cells, some cell constituents or macrophages or etc. gets accumulated, and upon that the lipids, usually normally cholesterol, gets deposited over it, and then finally it forms a plaque. So this plaque constricts the blood vessels, means it blocks the blood vessels. Okay, so thereby the amount of blood going, that is the total surface area for the blood to pass through this arteries is diminished, is reduced. So when this is happening simultaneously, side by side, the coronary arteries decreases its elasticity, and also the coronary spasms takes place at times. Okay, so this condition, there will be this condition is called as an atherosclerosis, and this will lead to angina pectoris when it is in the advanced state. That is, the advanced state of atherosclerosis will cause angina pectoris. Okay, so this is about the angina pectoris. Now, this angina can be classified into mainly broadly 3 types. Okay, typical angina, variant angina, and stable angina. Okay, that is depending upon the factors, that is the precipitating factors or the situation or the undesirable event which has taken place. Okay, so because of that, and also some electrophysiological changes may take place. Now, based on that, we can classify the angina pectoris into 3 types. Okay, the first one is the typical or the classical angina. So the typical or the classical angina occurs when there is a when the patient has the patient has undergone exertion or a severe workout like exercise or climbing the stairs or climbing the hill or etc. Or sometimes too much of emotions, or getting exposed to extreme cold, or had a heavy meal, etc. These are some of the factors for the typical angina, and this occurs only just 1 to 15 minutes, maximum of 15 minutes, and within around 1 to 15 minutes only. And this can be relieved by rest, by taking rest, or even nitrates also can be taken. So this is called as typical or the classical angina. And the reason is the mainly the atherosclerosis, advanced stage of atherosclerosis condition. We can have this typical or classical angina. And then the second one is the variant angina or Prince metal angina. In Prince metal angina, this occurs, the episodes of Prince metal angina can be seen when the patient is in the rest. There is a severe pain when the patient is in the while at rest. Okay. And this is due to this again, this also can last less than 15 or less than 15 minutes only, and it can be treated with the nitrates, so same like typical angina, but it is due to coronary spasm. Okay, it is spasm, that is a stiffness of the coronary artery blood vessels, the severe contraction of the coronary blood vessels, which is called as coronary spasms, is the reason for the variant angina or Prince metal angina. Okay, and then the next one is the third type of angina pectoris is the unstable angina, or it is also called as unstable angina. This may involve the coronary spasm. The reason for this is coronary spasm and also the atherosclerosis. Atherosclerosis. This can be either of this or maybe due to both, due to coronary spasm as well as for atherosclerosis. The duration of this, okay, the duration of this is not 15 minutes, is more than 15 minutes. It can extend up to 30 minutes also. And if it is not checked, it can lead to myocardial infarction. Okay, myocardial infarction. So, and very important thing, this unstable angina cannot be relieved by rest or any nitrates. Immediate hospitalization is required. So that is the characteristics of unstable angina. Unstable angina is the advanced stage of atherosclerosis, which is next is the myocardial infarction. Okay, and it is a being emergency condition where hospitalization is required, because it will not be treated, it cannot be treated by nitrates or just by taking rest. Okay, so this is about the various types of angina. So now next, so we angina means it is chest pain beta, right? So it is not that all chest pains are angina pectoris. Okay, so the chest pains can be it can be cardiac or it can be non-cardiac also. So all cardiac pains are not angina pectoris. So under cardiac pain also, only there are different reasons. All the cardiac pains cannot be angina pectoris. So under that also it can be ischemic cardiac pain or non-ischemic. So under ischemic cardiac pain, like the reason being coronary atherosclerosis or coronary spasms. So these causes angina pectoris. Okay, whereas the other non-ischemic pain, that is pericarditis or cardiomyopathy, will not be considered as angina pectoris. Whereas the non-cardiac chest pain may be pulmonary pain, that is the pain related to lungs, and GIT, esophageal spasms, and also we have some psychogenic chest pains like due to depression or anxiety or some neuromuscular skeletal pains. So these are some of the various kinds of chest pains.